Good Saturday morning to everybody, and welcome to HyperFit Radio with Dr. Charles Guglin, Francesca Guglin. I'm Gary Byron. Glad to have you on board. Hey, Doc. Hey, Francesca. How you guys doing?
Good. We had a good week.
I was right about to ask you.
Yeah. It's been a good week.
Is your week seasonal? Is there a time of year in which you see more clients and maybe a slower time of year? Or?
Yeah, things get slow for us around after Christmas. Things get slow.
Okay.
And then
for a lot of people, I think that's true.
And then springtime comes around and people start looking in the mirror with a little bit more closely. They come to see us, and now with the Zoom calls, I think people are seeing their faces a lot more than they ever do, and so we're seeing a lot more people for like Botox and fillers and stuff like that.
That's
those kinds of things, yeah.
Zoom will do
microneedling, that kind of stuff. So most men look at their face once a day, but now they're looking at their face all day long.
We've got a great topic today. I want to talk. We've been talking about women for the last, couple weeks anyway. I want to really start talking about, men for this show a little bit. But before we do that, just kind of remind us, what exactly is age management? Because I look at your business card, HyperFit MD Age Management Center. I know you're in Milford. But what exactly is age management? Give me your elevator pitch here.
It's
just because I got so many questions on today's topic. But age management, to simplify, it means what?
It's kind of a wastebasket term for all the things that occur to us as we get older. And for instance, as I just mentioned, on the surface of it, it's dealing with the skin aspects of aging, Botox, fillers, those kinds of things having to do with how we look in the mirror and how we perceive ourselves in terms of the way we look. It has to do with how we perceive ourselves in terms of our body composition. As we get older, we tend to gain weight and that kind of thing. So we do a lot of work managing that kind of thing. We've already talked on previous shows about andropause and menopause. So we do a lot of management in terms of hormonal management. So we do hair replacement surgery and hair restoration stuff, because what happens as we get older, some people start to lose their hair, women and men. So it really, that's why it's a wastebasket term, because it really has to do with all of the things that befall us as we age.
Mm. I would say aging with a good quality of life.
Right.
Wow.
Yep.
Men and women.
Men and women.
Yeah.
Yep. We talk about health span in our practice. We don't talk about lifespan. We talk about health span. We're trying to keep people healthy until they fall into the grave, basically, in a world where the healthcare system really allows us. They help us with medications and pharmaceuticals to deal with the symptoms of aging and the symptoms of the diseases that befall us as we age. But it's considered normal for a person to basically decline and fall out of their wheelchair into the grave. We don't think it's normal for people to decline that way. We want to help them to avoid that decline. And quite frankly, we enlist them in the process. They need to do the work.
Avoiding chronic diseases and reversing them, basically.
Yeah.
Wow.
Through lifestyle change.
All the more reason why this show is so important. We really tackle things unabashedly here.
Right.
And that's the beauty of this show, where you're not going to find this really anywhere else. Mm-mm. People can talk about finances. People can talk about sports. People can talk politics, pop culture, world events. But this is really a conversation that that's really needed. Really, people need to hear and learn from it. And no one else is really doing this, which is all the more reason why this show is so important. Because we talk about the things that, quite frankly, a lot of people don't like to talk about or are uncomfortable talking about.
They talk about behind closed doors.
Well, right, with their doctor or with their family members. They
don't even talk to their doctor about it.
Is that right?
Some of that stuff, yeah.
Especially women.
Yeah, not even women, not even with their doctor, huh? Mm-hmm. Who do they talk to? Their girlfriend, their best friend?
Probably.
Well, who's that? They're not going to tell you. How are you going to get facts from them? Oh boy, that could be trouble. Let's talking about anything nothing's off limits here.
Right.
Let's talk about erections.
Cool.
Cool.
Yeah. I like them. I'm for them. I'm for them. If you ever ask me, I'm definitely for them. Yes.
So am I.
Yes.
Well, let's start with 101 here, with the basics. How does an erection occur?
An erection is a multifactorial event that has much to do with your brain and much to do with the neurotransmitter system and much to do with your penis and the blood supply to the penis. Basically, either through tactile means being touched, or men are very visual in terms of sexual arousal, which is one of the reasons why the porn industry is so rich in this country. Men are very visual in that regard. So the signals that basically occur that get our libido going come together to cause dilation or widening of the blood vessels in the penis, and so more blood comes into the penis, into the erectile tissue of the penis, and you get an erection. And it gets trapped there basically for the period of the sexual encounter. And then at the end of that sexual encounter, that blood drains from the penis and you become more flaccid. On average, the average erection lasts about 7 minutes, on average, it lasts about 7 minutes.
Wow.
Yeah.
No, come on.
Yeah, sure. Because you're talking, just like everything else in the healthcare, in healthcare, they're comparing 18-year-olds with 60-year-olds. So on average, it's a 7-minute event.
I mean, I'm going to believe you because you're a doc and I believe you, but there's something I'm having a hard time believing about.
Well, I read it somewhere, so I'm going to give it to you. Yeah.
You say men are more visual. Are you saying women are not as visual as men? What stimulates women then?
Ask Francesca.
Okay, well, that's why she's here, right? You're more emotional, I would imagine.
Yes, yeah. I think tactile, olfactory. Don't forget that the way a person smells plays a large role. And I think in women, what I've read, and because what I've read is that women are very olfactory in terms of what stimulates arousal in women. Not so much visual.
I think intimacy with the person you're with.
Verbal intimacy, emotional intimacy.
Both.
Yeah, feeling close.
Both. Yeah.
Feeling close. Yeah.
Okay.
I think women are more emotional.
They're less visual, more emotional.
And they're more connected.
Emotionally connected.
Emotionally connected.
No. Ryan Roberts he's writing it down.
Take notes.
So why do some guys have problems with even not just maintaining erection, but even obtaining an erection?
That's a good question. It's multifactorial. I see some guys in their 30s who have failed once or twice and it got into their head. A lot of it has to do with confidence, quite frankly. I mean, if you failed a couple of times, it gets into your head. You start thinking about it before the event or during the event. Some guys get an erection just fine, but they start worrying about how long am I going to be able to maintain this, and they lose it. Mm-hmm. There are, as we get older, there are vascular reasons, vascular reasons why we can't maintain or achieve an erection also. So some of it has to do with age, some of it has to do with denigration of the blood vessels that supply the penis. But again, this is very much a neurovascular event, so it does have a lot to do with our brain as well as our the blood supply to our penis. Diabetics, for instance, have, as they get older, if they don't maintain good control of their blood sugars, they can have problems. They lose the microvasculature in virtually all their tissues, which is one of the reasons why they have problems with their feet especially. But the penis as well, they lose that tiny little blood vessels in their penis so that they have difficulty with erections. Men, for instance, who've had prostate surgery for prostate cancer, that does a lot of damage to the nerves that supply the penis. And so that neurovascular connection is lost as a result of that surgery. So again, and a lot of it, some men have failed several times in the past, and it's just so far into their head that they just completely lose the ability to have erections.
A lot of it's mental then.
Sure.
There's an old an old saying. I'm sure you've heard this, that the most sexual organ that you have on your body or in your body is your brain.
Absolutely.
Yeah. Huh?
Absolutely.
Interesting. I guess
I don't think it was Yogi Berra who said that. But
no, I don't think he said
someone's going to attribute it to him.
He has all those yogi-isms.
Yeah, right. Right.
What role do hormones play in this?
A lot of people think hormones, testosterone mainly is the hormone that we talk about when it comes to erections. Testosterone is not a treatment for erectile dysfunction, but it sets the stage for sexual function. Mm. So if a man comes to me with a problem with erectile dysfunction and he's got a serum testosterone, we talk about pretty much most men by the time they reach a certain age know what their total testosterone level is, but that isn't really a number that's useful. It's the free testosterone that we talk about in this business. And if their free testosterone levels are very low, then one of the things we talk about when we're talking about their problem with erections is we talk about their testosterone levels and getting to a point where we're optimizing those testosterone levels. That sets the stage for success in treating them for erectile dysfunction. It is not in and of itself a treatment, although some men, when you optimize their testosterone levels, they get it back. You know, I don't make those promises at all. What I promise is that we're taking the first steps towards success in getting their erections back. But some guys, when you optimize their testosterone levels, they're like, "I'm good, doc." You know,
good for how long?
Well, apparently, as long as they maintain those levels, as long as you keep their testosterone levels optimized to the point where it was when they were having successful erections, which is typically 30s and 40s.
Are there, I don't know, maybe diseases that can lead to difficulties with either obtaining or maintaining an erection?
Yeah, we talked about diabetes. Diabetes is a big problem. One of the questions when we get these phone calls about erectile dysfunction, which, by the way, is kind of funny because a lot of times the office phone rolls over to Francesca's phone, and we'll wake up in the morning and she'll look at her phone and she'll see that she's gotten a couple of calls at like 2 a.m. And you just know that it's guys who've tried and failed, and they went to the internet and they called us at a time when they're particularly bothered by it. But
putting it lightly there,
putting it lightly, right. One of the questions I always ask is, are you a diabetic? Are you an insulin-dependent diabetic? How long have you been diabetic for? Because as time goes on, people, especially people who are poorly controlled diabetes, they have a lot of problems with erectile dysfunction, and those guys do not have as much success with the treatments for erectile dysfunction as guys who are non-diabetics, because diabetes wreaks havoc with the microvasculature of your body, and certainly your penis is included in that realm. Certain connective tissue diseases, erectile dysfunction is part of a problem. We talked about prostate surgery, prostate cancer. Those people have had surgery, which does a lot of damage to the nerves, which populate the penis. And so those nerves, if they're damaged in any kind of surgery down there in the pelvis, they can have problems with erectile dysfunction.
I thought I heard you say, correct me if I'm wrong, does this usually begin in a mid-40s or?
Well, I see guys in their 30s who complain about their erections being softer than they were when they in their 20s, which gets into their head. So you really want to treat them for that, so that hardness comes back. We see plenty of guys in their 40s who are having problems with erections, and those guys usually it's intermittent, and it's much more has to do with their head space than their penis space.
And then you'd read interviews with Hugh Hefner when he was alive. This is a gentleman who died in his mid-90s a few years back.
Yeah.
And one of the last interviews that he gave to his own magazine, by the way, was, he doesn't have sex as often as he used to, or for as long as he used to in his younger years, but at his age, in his mid-90s, he was still having sex. So just to even get an erection, is that with testosterone? Is that with hormone replacement? Is that with...
Well, it's, first of all, he probably had a prosthesis, or he probably is using Trimix, Trimix is an injection. Trimix is an injection that you actually inject in your penis at the time that you are anticipating having sex, and it gives you an erection. It's Trimix. It's 3 separate pharmaceuticals that help you get an erection. There are guys in their 90s who've had penile prosthesis placed. He must have had a good urologist. But a lot of guys
he had the money for it.
Definitely,
that's for sure.
Definitely. Maybe he was on testosterone. There's a good chance that he was most of his adult life, because testosterone replacement therapy has been around since the 50s. So there's a good chance that he was taking testosterone.
And you can't overuse it. You can't just, if you start at a younger age and you're going to build up an immunity to it, and then eventually you'll either need more or your body will not respond to it anymore.
It's not something that you build an immunity to. Don't forget that from the age of 12 to the age of 45 to 55, you had plenty of testosterone. There's no tachyphylaxis is the word for acquiring an immunity to a certain drug. For instance, tachyphylaxis, you've heard of heroin, okay? Mm-hmm. Opiates, you always need more. Testosterone's not like that. Once a person's optimized and you know what their dose is, you can pretty much leave them at that dose.
Forever, indefinitely.
Yeah, I mean, you do the blood work, you ask them how they feel, so on and so forth, and if they're feeling like they didn't feel before, they're not getting where they want to go in terms of their goals or muscle building and so on and so forth, then you increase their doses. But for the most part, the dose that they're on when they're optimized is the dose that they stay on.
Right through into their 90s then.
Yeah, I guess, maybe. Yeah. My guess is that he had a prosthesis.
Probably. What about medications that you may be on?
Lots of meds, antidepressants, some anti-hypertensives. Yeah, blood pressure medications, antihypertensives, many cardiac medications can lead to erectile dysfunction. A lot of guys come into our practice who are on medications that are making things worse.
Is that right?
Yeah.
Folks, you're listening to HyperFit Radio Show with Dr. Charles Guglin, Francesca Guglin. Mm. I'm Gary Byron. What about, I guess, maybe the treatments for erectile dysfunction?
Good question.
Yeah.
We talked about testosterone and setting the stage. One of the things that we use in our practice is what's called shockwave therapy. Many guys may...
Just the sound of that gives me the willies here,
You just got all white.
Well, yeah, when I shot, you think of that word in association with this region, I'm like,
right.
My
The blood
goodness.
just drained from your face. Yeah.
Pulse
Pulse wave therapy is the word I typically use. And if you can think of a small jackhammer, it's kind of what it is. I mean, the sense that it's a hand piece that looks like a pistol. It's got a hollow, the barrel part of it has a ceramic ball in there that impacts a ceramic tip at about 17 cycles per second. And what it does, the patient comes in, we give him a numbing cream to numb his penis, the skin of his penis, and then we apply that to the erectile tissue. And the whole principle of it is creating minor injury. Now, let me say this right off the bat. We never see bruising, we never see bleeding, but creating minor injury to the tissue of the erectile tissue of the penis, so that what you're starting is the healing cascade. There's 3 phases of the healing cascade. Phase 2 is collagen production and so on and so forth, but phase 3 is what we're interested in, because phase 3 of the healing cascade is always neovascularization, or new blood supply. So what we're doing is alerting your immune system that there's something going on down there, and basically creating a system, creating a cascade where you are bringing new blood supply to the erectile tissue of the penis. Now, part of that program is also using what's called a vacuum pump, or a penis pump. These guys need to use a vacuum pump, which gives you an erection a couple times a day for 2 reasons. If a guy hasn't had an erection for a number of years, okay, which many guys who come to the practice have not, they lose the length and the girth of their penis, and it brings, use it or lose it. We've all heard that a million times. The vacuum pump helps to bring back the length and the girth of their penis, number one. And number 2, it helps to reestablish that neurovascular connection that is lost by not having had an erection for a long time.
Brings it back to the length and the girth of from when? From what point in their life?
From when it was good and it was working. Yeah.
Wow.
Yeah. Another thing that we want them to use is a supplement that's called Neo 40, which is something that they're taking. I don't know if I'm supposed to use brand names here. I apologize if I did. But we want to increase the level of nitric oxide, not nitrous oxide, but nitric oxide in the blood. Nitric oxide is what our own blood vessels utilize to cause vasodilatation or dilatation of the blood vessels. And we lose that as we get older. So we want to increase the level of nitric oxide in our bloodstream because that helps immensely in that regard also. So those three things are the protocol that we use. Another thing that we use is what's called a P shot, platelet-rich plasma, which is injected into the penis. And again, this creates or recreates that healing cascade to bring new blood supply to the penis. So those two things in the environment of an optimized testosterone level usually helps these guys to get them where they want to go.
Is it a 100% cure?
No, absolutely not. It totally depends on how far behind the eight ball a person is, how long they've gone without having erections, what their underlying problems are. We talked about diabetes, so on and so forth, what medications they're on that they have to be on. For, let's say you've had a heart attack and you've had stents and you need to be on some of these antihypertensives. I'm not going to take you off of them to help you get erections. So it's not a 100% cure. But by the same token, if a person hangs in there, that protocol that we talked about, the shockwave therapy, the protocol is typically 6 treatments in 6 weeks or 6 treatments in 3 weeks. You got to stack them and they need to be fairly close together for it to work. Many guys need 12, 18 treatments altogether to get them to a point where if they pop a Viagra, they have a good erection that works for them.
Spaced apart, each treatment being what, like a week apart, 2 weeks apart from each other?
No, we want them to be close together.
Okay.
So the minimum is 1 week. The maximum is 1 week apart. What we like is 2 treatments per week for 3 weeks, because you need to stack them and they need to be fairly close together to get where to achieve the optimal effect of the treatment.
What are Peyronie's?
Peyronie's disease is interesting. Peyronie's disease is formation of a plaque in the penis that results in a curvature of the penis when a person gets an erection. Sometimes it's so bad that the penis takes a right angle and a man can't even achieve penetration to the point where he can have sex. It's a plaque that you can actually feel in the penis. It comes typically from trauma, but not necessarily. I've seen many patients with Peyronie's disease who've just had regular average sex their whole lives and cannot remember any time where they've had any kind of trauma to the penis. And shockwave therapy is very helpful with Peyronie's disease also. It's not curative, but it helps to soften up that plaque so that angulation gets better.
So while it can't be cured, it can be treated then?
Yeah. Some guys will go to urologists and have that plaque removed, but frequently that results in full-blown impotence to the point where they'll never have an erection. So I'm not a big proponent for that kind of surgery.
Well, you just said the word right there. That's the word that scares a lot of men who are listening to this right now, impotence.
Yeah, right.
Differentiate then, impotence and not being able to...
Well, it's like anything else. We soften the blow by using a word like erectile dysfunction, but impotence is not being able to have an erection. So,
well, but it sounds like there is a treatment for erectile dysfunction, as you just articulated for the.
Right.
But does that mean that there's also, since they can be used interchangeably, these words of impotence and that would mean that impotence also is treatable.
Yeah, well, I did use the word full-blown impotence, implying that it's permanent. So let's say permanent impotence. So, yeah.
What could lead to that? Is it just age? Do you just get to a certain age where it's like all of these treatments are no longer going to... Yeah,
lots of this. Obesity is a problem.
Lifestyle is everything.
Yeah. Obesity lends towards it. Having a lot of belly fat, which basically causes... insulin resistance. Insulin resistance is a partial cause of erectile dysfunction. a lot of things that are lifestyle related. If you can take a guy who has pounds and pounds of belly fat and help him get better in terms of his insulin resistance and those kinds of things, a lot of times those erections can come back. So a lot of it has to do with change in lifestyle. A lot of it has to do, quite frankly, in getting him to a point where he can have several successful sexual encounters in a row so that it comes out of his head. It's not in his head anymore, to the point where he's like worrying about it. He comes to a point where it's not in his head as he's approaching intimacy with his wife or whatever.
I wasn't going to ask this question. I was actually going to ask you this off air.
Yeah.
But you brought it up.
Okay.
Several sexual encounters in a row, or several erections in a row.
Mm-hmm.
How many can a man have? I'm running out of time, so it may be in less than a minute. How many erections can a man have, or sexual encounters in one day?
Oh, no, I'm not talking about that. I'm just talking about the usual frequency of sex with his wife or his girlfriend or whatever.
Yeah.
If he's having problems with erections, and you can help him get to a point where he's having successful sex without, basically get it out of his head to the point where it's not bothering him
Get his
anymore.
confidence back.
Get his confidence.
Can you
That's
have? I mean, can you?
Perfect way to say it.
In your 60s, 70s, can you have sex multiple times a day? Can you get an erection several times?
I don't know. I hope so.
But
I'm not there yet.
Too,
But Gaines,
I'm in Medicare and I'm not having problems. So
people should check out the Gainswave website, because you're a provider and it has a lot of information.
Right. Gainswave is a marketing firm for the machine that we're talking about.
Gotcha. All right, HyperFitMD.com. Once again, HyperFitMD.com. Folks, if you would like to reach Dr. Charles Guglin, very easy to do so. 203-890-9777. Once again, area code 203-890-9777. HyperFitRadio.com. If you've got a question that we can answer on these airwaves next week. For Dr. Charles Guglin, Francesca Guglin, I'm Gary Byron. Until then, have a good one, everybody. So long.